When you're thinking about moving to Panama, sooner or later, your thoughts and your conversations are going to start to head towards things like healthcare, hospitals, doctors, insurance, those types of things. If you're only in your 20s, that could come later. But if you're in your 30s, 40s, 50s, 60s, 70s, those conversations really should start a little bit sooner and maybe even before you arrive. Fortunately, the healthcare system in Panama is top-notch, and I actually know people who have moved to Panama specifically because of the healthcare and because they were sick of the healthcare in Canada and wanted to get something different and something better. We're going to get into all of that today. It's the Unconventional Entrepreneur Show. Welcome back to the Unconventional Entrepreneur Show. I'm your host, Glenn Kowalski. Every week on this channel, you'll find new videos to help liberty-minded entrepreneurs and investors just like you break free from the system, pay less tax, and live anywhere in the world that you want. So go ahead and smash that subscribe and that notification button right now so you never miss your chance to find more freedom in this unfree world. Healthcare in Panama is super cheap. It's so cheap that a lot of young people, they skip the whole health insurance thing altogether and just use pay-as-they-go services when they need a doctor. In fact, my wife and I, that's what we did for years and years here. And I know people who have even had babies without having health insurance, although I think all of them probably got family insurance after that baby was born. When I broke my toe in a fight, I went to the emergency room and I got x-rays, got everything wrapped up and got some medications. I think my entire bill was like $8. Of course, the costs vary from hospital to hospital, but an emergency visit can cost anywhere from $1 to like $50 in the city. A consult with a doctor can be anywhere from included, like it was in our case in the hospital in San Carlos, to $15 in a clinic, up to about $40 is about the highest I've seen. I think I've seen a few specialists charge like $60 for a consult, but generally speaking, very inexpensive. Also, most of the drugs are extremely inexpensive here as well. Now, partially that's because they push the generic brands of most of the drugs, but the generics are just as good as the name brands anyway. There are a couple of exceptions, so those are things that you'll want to check in on because some prescriptions are more expensive here than others. But the good news is most drugs you can get without a prescription, other than the strong narcotics and certain specific antibiotics. Panama has both private and public hospitals available. The public hospitals are free for Panamanians to use, and they're very inexpensive for foreigners. And even as foreigners, we went in where my wife needed some minor work done, and they asked us if we could afford to pay. And if we hadn't been able to, they would have covered her. In her case, we could afford it. She had an emergency visit, consult, some minor surgery done, and got some medications for pain, and I think the total bill came out to like $20. The private hospitals are a little bit more expensive, but they're still very reasonable. Generally speaking, the private hospitals are slightly better. Not so much for the doctors, we'll talk about that in a sec, but more for the equipment that they have. A lot of the private hospitals have better equipment and better facilities set up. For the doctors in Panama, once you're licensed as a doctor in Panama, you can work in any of the hospitals, and therefore the doctors do tend to rotate between the private and the public hospitals. So you're not generally getting a greater quality of doctor care at other hospitals between private and public. You'll just get a better facility and a better overall experience. The healthcare and getting treated in Panama is probably a little bit different than what you're used to, but the doctors and the nurses are some of the best in Central America. For starters, when you go into an emergency room, the first thing you're going to do is you're going to go in and you're going to check in. And after you check in, they're going to send you to a receptionist to pay an admittance fee. That admittance fee is going to vary. In San Carlos, it's like $1. In the city, I think it goes up to as high as about $50. After that, the process becomes somewhat similar. You're going to go see a triage nurse who's going to put you in the queue based on where you triage out, depending on how serious your injuries are. Then you're going to go to your consult and to your doctors, and they're going to treat you. And then before you leave, you're going to pay your bill. In Canada and the US, I think you normally end up paying the bill completely after the visit. Here you do have to pay before, if you're able to. If you can't, they will still treat you and take care of you, at least at the public hospitals. The private hospitals may try to send you somewhere else. The clinics themselves are very similar to what you would find in the US. You walk into the clinic, if you have an appointment, you sit in a waiting room, wait to see your doctor. those are very similar model to what you're used to now, except for considerably less expensive. Another thing that you don't have to worry about in Panama is the quality of the care. The hospitals in Panama are equipped with the top of the line equipment, from MRIs to CAT scan equipment to all of the latest in surgical gear. Of course, some hospitals are going to be better than others. For example, Johns Hopkins in the city is going to have better equipment than some of the hospitals that are outside of the city or possibly in the poorer areas. But the hospitals in general, they have staff on hand 24 hours a day. They have specialists who can handle everything from cuts and bruises to the most serious cancer cases and other emergency situations that happen to come up. If you live outside of the city, you're going to find, though, that specialists are a little bit harder to come by, and you're going to have to set an appointment for the day of the month or the day of the week when that specialist actually comes to the hospital that's close to you. And because of that, everybody in that area is going to have appointments set up on that day in the month. And it's really hard for them to regulate the time. So you're going to end up waiting for a lot of time in the waiting room on those types of appointments, in addition to the fact that you have to wait to that day of the month to actually get in there. So that's something to be aware of, is that if you're out of the city, the specialists are a little bit tougher to come by, but they are available everywhere. So that's a big plus. The other thing to be aware of is that insurance is available in Panama. And that's normally private insurance. They do have public insurance for Panamanians as well. But there's the second tier of private insurance that most of the foreigners get. And anybody who can afford that higher level of care will go for private insurance. That private insurance is normally given through a couple different ways. First of all, the hospitals offer that, and that's the most common and the lower priced option. But if you go through a private hospital's insurance, obviously you have to use that hospital for any of your healthcare needs. Now, if you're in an emergency situation, they will allow you to use other hospitals and they will cover that. But as soon as you're stable, then you have to go to your own hospital for the remainder of your care. There is insurance available as well that will cover you in any hospital as well as internationally. But of course, you're going to pay for that privilege. But anybody who's used to paying healthcare costs in the United States especially is going to find those costs very reasonable. You can get insurance here over the age of 90 years old for a couple $100 a month. So it's extremely reasonable. Another thing to be aware of with the private insurance and with any of the insurance here is, like most places, it doesn't cover pre-existing conditions. Now, the good side is if you do have one of these pre-existing conditions and you need services for that, you will, generally speaking, get a discount of, like, say, 30% if you are insured for everything else. But do be aware, they're not going to cover you for an existing condition. You're not going to be able to come in for something you already have and get it paid for under insurance. So regardless of your age and your health situation, it's vital that you know and you understand that Panama healthcare is world-class, really. They have hospitals that are open 24 hours a day. They have specialists available, and they have all the equipment that you need for an emergency situation or a long-term care situation if you choose to live in Panama. They also have many advanced services available that many people want to take advantage of, either for the low cost or because they don't want to sit on a waiting list. So we have cosmetic surgery. We have all levels of dentistry available. And we even have advanced therapies that you can't get in many places in North America, like stem cell therapy. And again, relative to North America, the prices are extremely reasonable, both on the healthcare and, because of that, on the insurance that you can get. For more information on living in Panama, moving to Panama, what you can expect, what you shouldn't do, or if you're looking for more freedom and liberty in your life in general, so you're looking at things like second residency and second passports, check out the video that you see on your screen right now. And if you enjoyed this edition of the Unconventional Entrepreneur Show, hit that like and that share button. We would really appreciate it.